how autism affects kids and adults. Autism is a mental illness that affects a large number of youngsters. Such children have difficulty interacting with others and frequently exhibit strange actions. Adults, on the other hand, will experience this disease, which we shall address further below. In terms of development, children with this condition lag behind their peers. They may also lose verbal or social skills that they had previously developed. Such a child avoids interacting with other children and prefers to play make-believe activities. Children with autism often have sleep problems and eat bizarre things that aren't food. They want to repeat things and stay in their familiar surroundings. Parents of such children should keep track of their children's academic development by meeting with their teachers on a regular basis. Special toolkits are created by certain organizations and support groups to assist families dealing with an autistic child. Is exercise effective in reducing autism symptoms? Exercise has been shown in studies to assist children with autism cope with frustration and improve their general health. You can give your child whatever type of activity he or she like, such as playing outside or walking and jogging. Swimming can also be beneficial. It strengthens a child's senses in particular. Swimming is a sensory play exercise for autistic people who are able to properly signal their sensations, which is a common problem with autism. Contact sports are difficult for children with autism to play, but strengthening exercises can help. Star jumps and arm circles are two more typical autism workouts. Autism in women. The illness is more common in boys, but it can also affect girls. According to the CDC, 1 out of every 152 girls has autism. It may, however, appear differently in girls, but you can conduct your own research. Because of technological advancements and medical developments, diagnosing this illness is now simple. In comparison to previous years, there will be more reporting on autistic patients. Autism in adults. Adults with autism spectrum disorder, ASD, must learn to live with it for the rest of their life. Only a few persons with this condition live independently since they require constant care. Adults can live a normal life with the help of various treatments, including early-stage therapy. Adults are sometimes diagnosed at a later age due to a lack of knowledge about autism among medical practitioners. If you see any adult autism symptoms, you should consult your doctor for a diagnosis. Autism in adults. Adults with autism spectrum disorder, ASD, must learn to live with it for the rest of their life. Only a few persons with this condition live independently since they require constant care. Adults can live a normal life with the help of various treatments, including early-stage therapy. Adults are sometimes diagnosed at a later age due to a lack of knowledge about autism among medical practitioners. If you see any adult autism symptoms, you should consult your doctor for a diagnosis. Having an understanding. Despite several studies and medical procedures on autism, there is always a need to raise awareness about the condition. People should be aware that ASD varies from person to person and is influenced by the characteristics mentioned above. Patients with autism respond to various treatment modalities in different ways. Even caregivers and parents have opposing viewpoints when it comes to an autistic child. However, knowing about the disease and getting a diagnosis isn't enough because there's still a lot of misinformation about it. As a result, greater research and public awareness initiatives are required.